Hello and welcome. My name is Mary Rose Somariba. I'm a writer and editor out of Cleveland, Ohio, and I am interviewing Jessica Davidson today. Jessica is a fertility awareness educator and advocate, and she teaches the symptothermal method with a couple-to-couple lead. It's a fertility awareness method of charting. And she also serves fertility awareness by being a facts speaker, and more on that in a little bit. And also Jessica writes at Natural Womanhood, naturalwomanhood.org, where I am editor of the content. There's articles there and resources for people hoping to learn more about fertility awareness. Welcome, Jessica.
Thanks, Mary, for having me.
I'm so glad we could sit down just to share a little bit of the knowledge that you've gained since learning a fertility awareness method yourself and then becoming an educator and speaker for facts. So tell us a little bit, tell me how you started out being introduced to fertility awareness.
Well, like many women, I was not satisfied with the answers that my doctor gave me to help with my reproductive health issues. I had suffered throughout high school with painful periods, and I was basically offered two options by my family doctor, and that was either the birth control pill or increased painkillers targeted during the time of my period. And I really didn't want birth control. I was not sexually active at the time. And I didn't understand why I'd want to take a pill every day to resolve issues that I was having on 2 or 3 days of the month. I, in general, like to avoid taking medications I don't need. So that really didn't seem like a good option for me. And I kept my ears open for other options. And it took a couple of years. I was not hearing options. So I did go with the increased painkiller that he recommended. That did help. And through family friends of my parents, actually, I started hearing about this thing called natural family planning, and which is a term that is pretty synonymous with fertility awareness methods, except when you discuss it as natural family planning, it's obviously focusing typically on the family planning elements of fertility awareness. But I heard about that topic and I was intrigued. And when I was in college, I had an opportunity to write a paper on any topic. And that's the topic I picked. And as I researched it, I was just fascinated at what I was finding. The medical benefits of fertility awareness, as well as like references to benefits in relationships where it was used. So I was intrigued. And shortly thereafter, I met a teacher near my hometown. And so she, with her husband, talked with the couple to couple league, and I asked if I could join a class, even if I was not a part of a couple. And she said, absolutely. This is information every woman deserves. So I took that class, started charting, and I was amazed at what I saw in my chart. And it really, there's something about reading something in a book and saying this is what you're supposed to see, but actually charting those biomarkers and seeing my chart like appear and realizing that my body was working, and it wasn't working perfectly. My chart did reveal some issues that I was having. That same NFP teacher told me about a doctor who knew how to read charts. So I took that chart to that doctor, and she helped start dealing with some of the regulatory issues that I was having. But at the same time, I saw other things that were a lot more normal. For example, I had kind of adopted the idea that a lot of women have. When you study human reproduction in biology or health class, typically they're going to say the average length of cycle is 28 days long, but you never hear what's normal. You just hear the average. And it turns out that the average is 28 days, but the normal healthy range is anywhere between 26 and 34 days. So I was normal. I was in that range. And I also discovered that your cycles can vary. It's totally within the range of normal for a cycle to be 29 days 1 month and 31 the next. And that fluctuation is part of the complex interplay of our hormones and totally normal. So it was just so encouraging and empowering to know that I was starting to understand my body at a deeper level. I was starting to be able to predict when I would get my period. I was being able to predict when I was or I could know when I was ovulating. Um, yeah, it was just incredible, a wealth of knowledge. And I became very, very passionate at that point that every woman should understand what is going on with her body. And my sister jokingly said at the time, I think you could work NFP into any conversation. And I give me 5 minutes and I just might be able to do that.
And that's a skill, and that's why it's so great we could chat with you because yeah, no, bringing up natural family planning and women's cycles and period health isn't usually considered a everyday conversation, but it is something we should talk more about. So did that fertility awareness class and information that you took in, did that help your period pain to decrease, or the pain you were experiencing? Did you learn anything about supplements or things you could do to change those symptoms?
Yes. So one of the things that you can do is actually use like ibuprofen painkillers, but you can target it. And that actually is often the most effective if you can start it about a day before your period starts. So with charting, I was able to target and I could tell from my temperature signs that I was about to start my period. So I could actually start the pain medication the day before. So it was maximally effective. And then I didn't need as much after those first couple of days. And I also revealed a luteal phase defect. So after a woman's cycle can really be divided into two phases. The first phase is the follicular phase that starts with her period and goes to the point of ovulation. The second half of her cycle is from the point of ovulation to the beginning of her next period. That's called her luteal phase. And in that time frame, if you're charting your temperatures, which the symptothermal method does involve that, this is a particular method that combines observations of cervical fluid with taking a woman's temperature and using them in conjunction to cross-check her fertility and whether she is fertile at this time or is not. And so the follicular phase is the part of the cycle that your body's gearing up for ovulation, and it's going to be usually where the most fluctuation happens in the length. So sometimes it can be 13 days, 14 days, 15, 16, 17, depending on the woman. But once a woman's ovulated, from the time of ovulation to the time of her next period, that luteal phase is pretty consistent, or it should be. If it's not, it's actually a sign of underlying hormonal issues that should be investigated. But during those same two phases, the hormones that are involved also affect your basal body temperature. And your basal body temperature is your temperature at rest. And in the first half of your cycle, it's lower than it is the second half. So I was observing the rise at mid-cycle of my temperature going up like it was supposed to. And then just before I would start my period, the temperature sign would drop. And I would have, so that would be my clue that my period was going to start. And so I was never again surprised by a period, which is a great relief for a college woman who's working and doing papers and just trying to keep track. And I will note that because I was not using it in college as a family planning tool, I wasn't even the most consistent in my charting. I'd forget to temp, I'd forget to observe mucus, but I was still able to benefit even with spotty recording of signs. I could still see a pattern emerge that was enough to help me live a better and more productive life.
That's great. I can hear how, from what you're saying, how it informed you about your own fertility health, but also how it encouraged you to have greater precision in your treatment that you were using, and to have a little more foresight when that period is coming, which is very helpful information. So, as you mentioned, also fertility awareness methods can be used for family planning. And now you're married and have 5 children. And so, can you tell us a little bit about how fertility awareness has helped you in family planning? I know that while you do have those 5 lovely children, you did use NFP for spacing at different times when you needed to. Can you tell us a little bit about the effectiveness of fertility awareness methods for doing that?
Absolutely. So when it comes to avoiding pregnancy or postponing pregnancy, the method of effectiveness of the symptothermal method that I teach is over 99%. And if the typical use rate is about 98%, I believe. And the reason it is such, and that's of course, method effectiveness means that the person has learned the method with a trained instructor and that they are following all the rules for the method, including making all the observations and recording them. And once you have that, that's going to give you a clear picture of your fertility. You're going to be able to know when you've entered into that fertile time, which is, in roughly speaking, the middle of a woman's cycle. She's going to have days of infertility around her period, and then a couple of days after. Then she's going to go into a phase of fertility leading up to ovulation. And because we can't know with precision when ovulation happens, there's definitely signs, but you can only know for sure that someone's ovulated if you have a picture through ultrasound. But there's a lot of different signs that all happen at the same point in the cycle, and that gives you an indication that ovulation has happened. And so a couple of days after that, a woman knows she's no longer fertile, and she knows from that point on to the end of her cycle, end of that cycle, she will be infertile. So if a couple is wanting to avoid pregnancy, they simply abstain from sexual relations during the time when they've identified she's fertile. And if they're trying to achieve pregnancy, they reverse it and they make sure that they are having relations during that time of her cycle. And they can actually pinpoint with great accuracy for achieving pregnancy. So one study showed that about 85% of couples will conceive with random acts of intercourse within a year. So if you had 100 couples and they had a year to get pregnant and they were just having sex whenever, 85 of them would most likely be pregnant within that year. But if you took 100 couples and they were all targeting their fertile period by utilizing a fertility awareness method, 81% would be pregnant within 6 months and 98% within a year. So it almost cuts your time in half if you can target that fertile time, because it really is such a short span of a woman's cycle where she can actually conceive. And so for my husband and I, we got married and we had decided to use fertility awareness as our method of family planning for our family. And we took a class when we were engaged. Obviously, I took a second class and he took it the first time. We wanted to be on the same page and make sure that this was something that we could support each other with, which is another element of fertility awareness that I absolutely love. Because for so many other methods out there, in fact, all of them, it requires one or the other of the spouses to take the brunt. So no matter what other method you're using, it's all on you, or it's all on the partner, and that sounded stressful to me. I wanted to be united with my spouse. I wanted us to be on the same page, so my husband could read the charts. We actually teach together, so he can really read a chart. But even before we started teaching, he could read my chart. He knew what was going on, and we could make an informed decision together about where we were. Did we want to try for a child, or did we have serious reasons to avoid pregnancy? And when we first married, we just learned that we were really happy and we were at a place where we could welcome a child, and we didn't get pregnant. In fact, within a couple of months of looking at my charts, we said, there is something going on. This is not what a normal chart looks like. And so we were able to take that chart to a doctor who could again read charts. And she looked at 5 years of charts by that point that I had collected. And she said, yeah, I see an issue. I think it's polycystic ovarian syndrome, PCOS. And what we need to confirm that with blood work and an ultrasound, which we did. And while my blood work was inconclusive, the ultrasound was not. And so within 2 months of taking my charts to a doctor, we had a diagnosis. And what I really appreciate is that I had a borderline case. There was not a lot of symptoms of it except the actual ultrasound. So that could have been something that, had I not been charting and I didn't have access to a doctor who could read my charts, it could have taken longer to get to that point of finding me something that would help restore my fertility. So by this point, we had been married for almost 6 months, and we found a treatment plan for my PCOS, it worked. And then several months after that, we conceived our son. And we're very grateful. But we sincerely doubt we would have him if we hadn't been charting. But he threw us for a loop and he decided to try arriving 15 weeks early. He was not successful in that venture, but he did come 10 weeks early and spend 5 weeks in the NICU. So, in those circumstances, suddenly it was really important that we postpone pregnancy. We didn't know why he had come early. We didn't know if it was, infection, if there was something wrong with me, with him. And he, being a preemie, needed all of the nutritional support he could that he was getting through breast milk. And so our doctor recommended that we postpone for at least a year. And so that started a really chaotic time of charting because we were in postpartum. And I do like to make sure every woman knows, if she's using fertility awareness, that times of transition, such as the postpartum transition, so your body going from being pregnant to breastfeeding to back to normal fertility, those hormonal changes are challenging or can be. And depending on your particular physiology and the breastfeeding type or the feeding type, if you're using formula or breastfeeding and how you're breastfeeding, can really impact your fertility. And so my signs were quite confusing at this time. I was consulting with our teaching couple who had to send us to the central office of CCL because they were not sure how to help us interpret our charts. And so we did get help there. And yeah, it was hard and it was confusing, but we did get help and that helped us to navigate it better. And so yeah, then eventually we were able to postpone until we were ready for another one. And that's really how it's been with all of our children. There's not been a surprise baby. There hasn't been a break the rules baby. Now, fertility awareness is a method of birth control, and it is not 100% effective. It does have a slight failure rate, but on the whole, what I've seen as a teacher is that we have, I like to call them break the rule babies. They're those babies you're like, I think we're good. I know the rule says you should wait 3 or 4 days, but I'm sure 2 is fine. Or I might have seen some mucus today. No, I'm just imagining it. I missed it. And then couples engage in the sexual relations and then discover that there was a reason the rule was what it was. So I just, again, would encourage anybody who's looking at fertility awareness, learn an official method from a trained teacher, and then follow the rules if you want to avoid pregnancy. And if you want to be open to whatever, like my husband and I were that first year, and just use the charts as a reproductive health record, that's great. Another advantage is that it really helps you know when you conceived. And this is something also that happened with my son. He was born early, but he was really big for his age. He was about a pound bigger than the doctors expected. And one of their first questions when we got to the NICU was, "Are you sure about your dates?" And I could say with absolute certainty that I was extremely confident that he was 30 weeks, 5 days old when he was born. And sure enough, over the next couple of weeks, his developments hit all the other normal milestone markers. It just so happened that he's a big kid, and he still is. He's almost taller than me now, and he's 10.
Well, that's a fascinating story. I'm so glad to hear how fertility awareness not only helped space children later, but also helped you and your husband conceive during that time when at first conception wasn't happening with your regular routine. So a little bit about the doctor you saw. You said you saw a doctor who could help you with, who understood how to read fertility awareness charts.
Mhm.
And so why don't we talk a little bit about how doctors can help with this, and who are the ones who are trained, and where does one find one of those doctors? And then also you can tell me a little bit about how FACS is trying to get more fertility awareness information into medical schools and into more doctors' hands.
Yes, yes. The one of the common questions that I had it myself when I learned was, why didn't I learn about this beforehand? How did I not know? This is really straightforward, physiological, anatomical information that every woman should have. And one of the reasons that I didn't have it was that most people don't know about it. It's not part of most curriculums, including in medical schools. Less than 10% of doctors that have been trained today are familiar with modern methods of fertility awareness. They may have some recollection of having heard about what was called the calendar rhythm method, but that was not, um, goodness, excuse me. So we are,
You were saying the rhythm method and how this is different, how fertility awareness, modern
yes,
evidence.
yes. So rhythm method was a retrospective method developed in the 1930s. And when it was developed, it was based on the very latest science, and it was as effective as the other methods of family planning at the time. But times have changed. Our methods of birth control, all of them have gotten more effective, and so has our fertility awareness methods. And so the difference between modern ones is that they look at the details that are occurring in a woman's cycle on a regular basis. So you're doing a day by day analysis of your fertility. Analysis makes it sound a lot more complicated. It's just a couple of observations. It takes less than 5 minutes a day. Once you get good, probably less than 2 minutes. It's just throughout your day, you learn to observe what's happening around you as you're going to the bathroom and things like that. So with these observations, you have a really effective method. But again, most doctors aren't trained in medical school or residency. And so they don't know to tell their patients, or they themselves have not been trained in a method. And so this was a recent case with me. I was talking to my OBGYN with the birth of my daughter, and I asked her about it. And she's like, oh, I've heard about it. I know it works, but I personally don't know anything about it. And I couldn't teach anybody that, in part because she's busy. She's got a full slate of patients. So she didn't know of a teacher to recommend. And so I was able to give her my card and say, hey, I'd love to connect people with either my method or another method in the area. So yeah, but I was really excited just to know that she had a positive impression of fertility awareness, because some doctors can be very disparaging. I once brought a chart to a doctor. He looked at it and he was like, I don't know what that is. I can't read that. And he dismissed it. And it's like, okay, all right. So yeah, so that's actually a pretty common experience. So how do you find a doctor? Well, there's a couple of different kinds of doctors. Doctors that utilize fertility awareness in their practice fall into the category of restorative reproductive medicine. And it's an approach to medicine that says that a healthy woman is one who has regular cycles with regular ovulation, and that if that's not happening, it's a sign that something's off and that we should work with the system to restore it to health. That's the restorative reproductive medicine. And there's a couple of different types of restorative reproductive medicines. One of the most common ones in America is the Creighton Model Fertility Care System. And this was developed by Dr. Thomas Hilgers. Training's based in Omaha, Nebraska. And these doctors are trained to read charts. And both of the doctors that I consulted with were trained by in Creighton method. And so there's also a surgical component, so they can actually do surgeries if there's an actual anatomical problem, or if a woman has like endometriosis and needs surgery, they can utilize that. So that's one kind. Another one is FEM, which is
it's fertility education.
fertility
And
I was like,
medical management.
I wanted to say female, but I was like, no, that's not it. Fertility education, medical management. And so they have both a method that they teach, both Creighton and FEM have a method that they teach for patients, and then they have a medical education for doctors component so that the doctors can learn to read the charts. And so FEM takes a little bit different approach. They focus on the endocrine system and making sure the hormones are functioning well. And there's a few other doctors. I know the Billings method is another method, and they also have doctors who are trained. I know less about any kind of formal doctor's training for Billings. I just know that there are some insight for doctors who are trained in Billings. So how do you find one of these doctors? Well, thankfully, the organization I speak with, which is FACS, which is the Fertility Appreciation Collaborative to Teach the Science. The website is factsaboutfertility.org. We recently launched a medical database, so women can come. Medical providers can upload their information and women can search it for locations. And I think Natural Womanhood has also developed this too, right? Is there one for you guys too on your
Right,
website?
there is a database, yeah, of restorative reproductive medical doctors well, we have links to where you can find them, and then we have our own list. There's some doctors who support natural womanhood who are called doctors for natural womanhood, and then there's
Okay.
also a list of telehealth doctors who gave us their information for the COVID pandemic, so that anybody who's having trouble getting the care they need, seeing their regular doctor, or who are trying to find solutions from home to their reproductive health needs, they can reach telehealth doctors.
Yep. So there's naturalwomanhood.org. There is factsaboutfertility.org. And then you can also probably go to the FEM website or the Creighton model website and look up doctors. I know they have it, but I don't know their websites off the top of my head, but they are just a Google search away.
Right. And you can find all those websites also, yeah, at naturalwomanhood.org. I know that fertility care is another fertility care centers, or what Creighton calls them, for NAPRO technology. And a lot of people I know have received some restorative care through those methods and through those doctors. Well, that's fascinating. It's great work to try to bring this to more doctors so that more patients can find the answers they're looking for, and to serve their reproductive health needs more with greater precision. And can you just, I guess, to zoom a little bit out, can you tell me a little bit about how fertility awareness has helped you get in touch with your feminine identity? I know that that's something that has meant a lot to you. Can you expand on that?
Sure. I think I referenced it when I first started charting. I saw an element, um, it was an opportunity to get to know myself better. And as you chart, you start to see how you function on a deeper level. And of course, it's a biological element, but it also starts to kind of work against the lies that we kind of let into our mindset from our society, our culture. Um, I know for myself and other women that I've heard, we grow up hearing these statements about how a woman needs contraception in order to achieve, to reach her goals, to accomplish things in the world. Like she needs contraception, that contraception is healthcare. And the reality is that, especially hormonal contraception, what it's doing is suppressing a woman's natural cycle. It's not working with it. It's at best, if she has a medical issue for which she was prescribed contraception, it's symptom management. Now, sometimes the symptoms she's experiencing are so excruciating, she absolutely needs help. And it might be months or longer before she can get the care she really needs. And so as a stopgap, it can help with that. But a lot of times women are put on the pill for years. And if you talk to them about it, like, well, I was put on it for irregular cycles. And then they're on it for decades. Well, it's not curing her cycle. She doesn't have regular cycles. It's a suppressed cycle. So she could go off that pill, especially, maybe she's ready to have a baby. Well, if those irregular cycles were caused because of a medical health issue, she goes off the pill 10 years later, that medical health issue could very well still exist, but it could have gotten worse. She has to figure that out now. And as I thought about all of these things that, like, we need contraception to be successful, I thought of, like, no, I don't need to suppress an integral part of myself in order to succeed. Um, my fertility is not a threat to my well-being. My fertility isn't some element that I need to reject to get ahead. Now, I did grow up with an incredible mom as a role model. She was a woman who had gone on to get her master's degree and had worked. And then when she had my sister and I, she really just wanted to stay home and help us grow and mature. Eventually, she would go back um, into the workforce, and she loves her job as a teacher of adults, learning English as a second language. And that's been very fulfilling for her. But I saw a woman who was not held back by her children. And I knew that I also wanted to be a mother. And I had from a young age, I had lots of dreams. I did want to be a teacher and I did want to go to college and really expand my educational horizons and to study subjects I found fascinating. And I did. But once I was able to have my children, as I suspected all along, they were not an impediment to my flourishing. They've helped me to grow and become a better person, an incredible, well, I don't, I'm not saying I'm incredible, but they've really given me just an incredible perspective on the world that I wouldn't have gained without each and every single one of them. And I know not every woman is called to have 5 children, but I do think we need to help women understand that their fertility is not a threat to be thwarted, and that it can become an integrated part of who they are. And it's a sign of understanding yourself and leading to a better life. I've also, just on the practical level, how allowed it to help me nutritionally and to notice, hey, I need better sleep. Um, the female reproductive system, it's integrated with every other system. It affects her brain and her bones, her heart, her, I think it might even affect our muscles. I'm not sure on that one as much, but it's all integrated. And so as you chart and you see issues with your chart, you can find solutions by nutrition and sleep and things that just make your life better. And and I love that. And it's also helped with my relationship with my husband and allowed us to have a point of communication and discussion. Like I said, it's we're united in our family planning conversations and our goals. And we have to talk about it and we have to see. And I cannot tell you the number of times that we've started a monthly check-in and being like, hey, are we on the same page? Are we avoiding? Are we achieving? Whatever. And that 5 minute check-in turns into an hour or more conversation because wait a minute, one of us is at a different place or something's come up and we haven't had a chance to talk about it yet. And so I might learn that his job is stressing him out or, his health is bothering him. And you can get busy. It can be really easy to not have that time to talk. And so I love the fact that my method of family planning, my method of just charting my own health enables me to communicate with him and just be a team even more than we would be.
That's just beautiful. And you said at one point there that your fertility doesn't have to be a threat to your other goals. And that actually also reminded me of a phrase I sometimes hear from people who struggle with infertility,
Mm.
where they think their body is an enemy or is against them, is working against them, and how that could be really hard, especially if perhaps as a teen you had a regular cycle and you were given the pill to help mask some symptoms, and maybe some issues in your fertility were there, but that nobody diagnosed them at that time. And then a decade can pass. And when you're ready to have a child, you can struggle. So just a word about how fertility awareness, if you could share how fertility awareness can help couples you did say how it doubles the time or cuts in half the time that they can conceive. But have you known anyone who's been impacted by that and had turned in learning fertility awareness to see their body as something that they can work with instead of as an enemy in their goals?
Yeah, I mean, fertility awareness is a tool, um, and it can reveal what is going on. And hopefully, it can help a woman see that her body is a gift. And the cross of infertility, the difficulty of infertility is something I want to speak with such carefulness because it's such a heartache for so many people. And it's one that I think one of the other unfortunate myths of our culture is that it's really easy to get pregnant and that you can get pregnant so easily, like any day. I mean, I've even read articles that said you can get pregnant any day of the month. You can't know when you're going to get pregnant. And oh my gosh, no, it's a very, very small window of opportunity that you have every month. And there's only so many years in which it's possible. And So to grow up in a culture where you're constantly told that you can get pregnant so easily and that you must go on this medication, you have to have this device inserted to protect you from this serious, grave illness, and then to go off of that to get that taken out and think I should be able to get pregnant, um, and then not, um, it can just really compound the feeling of aloneness and suffering that a couple with infertility has. And I guess I would hope that any woman who is suffering that, who is charting, would be able to receive her body as a gift, but also to recognize that there isn't a guarantee. Like a child is really a gift, and our fertility is, it's not guaranteed. And I don't want someone to, I want them to be able to embrace their life fully and to understand their body and to receive it for who it is and for what it's doing right now. It's a part, it is you. Your body is you, and your fertility is an integral part of that. And if you are struggling with infertility, um, pursue restorative reproductive medicine, but at the same time, pursue your spouse and your relationship with one another, and realizing what a gift you guys are, and also to know that a child isn't the only way that you can impact the world. I never want to over overshoot how much fertility awareness can do. It can, for every woman, give her insight in her body. It can give her that information, but it might reveal something that is actually heartbreaking because there's an issue that can't be resolved of. And thank God that's a very small percentage of women. But if you're that woman experiencing that tragedy, that's something to be mourned and to be dealt with. Um, and and I would just really encourage a woman to do that, because I don't want to make promises that it can't deliver on, because it's not.
Right. Well, you know what I do appreciate about restorative reproductive medicine too, there is that when it comes to these fertility issues, it treats the woman like a patient deserving of care, not just let's make a baby with an some assisted reproductive technology, and your issue still hasn't been resolved. So even if a child can't be conceived for a certain couple for whatever reason, restorative reproductive doctors will still help resolve as best they can that woman's issues so that she can have a flourishing health, have flourishing health in her own right, with or
Yes,
without any
absolutely.
children that come.
Yeah. We don't want to see our fertility as a threat, but we also don't want to make it an idol. We don't want to make it like the thing that we have to have. It's, again, it's an integral part of who you are. And I think that's a great point, that you as a woman should have good health. You should have a functioning reproductive health so that you can, you know, achieve your goals. And so you're not like experiencing debilitating cramps or any other life altering or life inhibiting issue. And so, yeah, I agree. That's one of my favorite things about restorative reproductive medicine doctors. With the approach is that most of them, in my experience, are better listeners. Like, and they want to investigate and really get to the root and to the heart of the issue, so that you can be healthy. Because they know if they can help you get healthy, the likelihood that you'll be able to conceive goes up, because it's a healthy woman who conceives, or at least a regularly ovulating woman that can conceive.
Well, tell me, Jessica, before we sign off here, where can people find out more about these resources and about the work you do?
Well, like I said, I teach with Couple to Couple League, and their website is www.ccli.org, and that's for Couple to Couple League International. I speak with FACTS, and again, their website is www.factsaboutfertility.org. And at this time, I do not have a website or any resources to reach out to me, but if you contact those organizations, I mean, I'm one of their teachers and speakers, so they could probably get info to me.
Right. And also, of course, we can update this YouTube video's data at the bottom, or description with more information as if you do, grow your own site, which I know may be in the works. I do want to say thank you so much for sitting down and sharing this information. It's just such a wealth of knowledge that you've gained over the years that I know will be beneficial to people who are looking for answers on these questions. And so thank you, Jessica. And
You're
thank
welcome.
you, anyone who's tuned in, who's listened along with us, along with me. Thank you for joining, and please don't hesitate to reach out to those resources Jessica mentioned. And thank you again for joining us.